Okay, hi, it's Dr. Buford. We're just getting started on your left shoulder. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. We examined your shoulder before we started, and we found one of the things that I wanted to check, which is that you had significant posterior instability. Your shoulder was dislocating in the posterior direction. It's a little bit hard to assess in the office because you were protecting that. And so now as we look inside, at the very least, I know I'm going to be tightening up the posterior ligament and posterior capsule, all the while trying to balance the joint. So now we're going to look at the biceps tendon and see if you have a slap lesion, and you do not. This is the biceps tendon on the right side of that clear cannula. The biceps anchor is down here at the bottom. This is not a slap lesion. It's a little bit suspect on the MRI scan, but I think that's not something that needs to be repaired in my experience. As you look up at the rotator cuff, it looks awesome. No signs of any problems with the rotator cuff, so that also is good news. I really think the problem is going to boil down to just having an unstable shoulder. As we look towards the back of the shoulder, we can see how much space there is back here. This is, I know something you haven't seen a lot of, but you'll have to trust me on that. This is a lot more laxity in this posterior capsule than we normally see. As we pull back, you can see how that glenoid is just sitting there like it's on an island. And you can see how the posterior labrum has even been frayed from the recurrent subluxations as that humeral head's been slipping over the posterior aspect of the joint. Okay, and that extends all the way around there. So that is really the pathology, I think, and we're going to get to work on fixing that. It's fixable. We can stabilize it. Pretty good success rate. We're going to go ahead and reposition the camera to the front. Okay, so here's the look from the front to the back. We have this blue dry dot cannula in the back of the shoulder. This is posterior labral tearing here, but the labrum's not detached. It's just kind of peeled off. The humeral head, when it subluxates posterior, would just kind of peel this labrum back. You can see the ongoing signs of that, but it's not detached. And what we're going to do is we're going to take a spinal needle, and we're going to get ready to place some suture anchors back here. So we're going to place our first anchor down about here, kind of get our overall view here. Suture right here. So we're going to try and get our first anchor down low right about here. So we'll make a little nick in the skin. We'll show you some more in just a minute. Guide coming down. We're going to place this first anchor, get that great on the edge of the glenoid right here. Okay, and so we're going to go ahead and drill a hole. We're going to hold this real steady just like that. And we're going to drill a hole with a little guide wire. Here's our anchor in the bone. It's very solid. You can see I can move the whole glenoid by tugging on it. We're going to go ahead and take a pincher tool and a crochet hook and show you how we move these sutures around next. We've got the sutures ready to go. It's real important to keep this great cannula right about there. We can see it gets pretty hard. And we're going to take a grasper in the front of the shoulder and what we call a turn to the right suture hook coming in the back of the shoulder to make our stitch. So if you look at that blue cannula on the screen, you're going to see a suture hook come through it here in just a second. There it is. And so you can see how we're going to go through the capsule like this. We're going to rotate our wrist, and then the point of that hook is going to come out facing the glenoid. So that's why it's called the turn to the right. So we're going to start here. We're going to rotate back into that capsule. That's the first half of our bite, and then the second half is we're going to go underneath that labrum and come out right about there. Okay, so we've got our guide in for a second anchor, but I think before we do that, I was worried that I wasn't going to have room if I tied the first one, but I think I will. Okay, So let me see the turn to the right. Grasp it. Okay, so we're going to start here and try and take this one in a little bit more to the left, which is a little bit more superior. And then we're going to do this as a mattress stitch, which means we're going to come up right about there. I'll show you some more in a minute. There's the first mattress stitch. You can see the cut edge of the sutures there. We're going to place another anchor right where this labrum's torn. Before we do that, we're going to put the shaver there and smooth it out a little bit. Okay, so here you can see our positioning. We're placing another anchor down. And that's down in the bone. We're going to unload the inserter. Back that out, and there you can see you've got two more sutures to work with. I have to pull back. If you watch closely, you'll see me pull back like that. Oh, that came out. That's why we do it. And one of the questions, we put in a slightly different part of the bone that's stronger. You may have hit a little cyst there. So here we have it placed and set in a good spot. See as I pull this, bring in the whole glenoid. We're going to go ahead and put a crochet hook in the back there and a pincher to me. Okay. And now we're ready to pass the stitch. We're going to take a turn to the right, grasp her in the front. This mattress stitch is going to be a little bit different. We'll show you what's different in a minute. We're going to start here, rotate, we're going to go into the capsule about here. Feeding that through. Second stitch, it looks a little bit different than the first one because we did what we call a figure 8 stitch. See how these sutures cross there? We're going to tie them now. We do that because the labrum was a bit more compromised here. I think this gives me a little bit more security that we have a good hold on the tissue. So we will slide down our knot pusher right there, and we'll go ahead and tie this non-sliding knot. Stitch tied in the back. And I want you to remember, or even go back on the video to the beginning, how much space there was back here. And now we've really closed that down. And I'm very happy with the way that looks. And hopefully that'll all heal up and be okay for you. We're going to look down the front. Sometimes you also have to put a stitch or two in the front to tighten the anterior band of the inferior glenohumeral ligament. And I don't really think we need to here, because as I pull back, and we look at the anatomy here, that looks pretty tight. I don't think there's any need to tighten that up any further. So we're going to finish up here and get you back to the recovery room. I really hope that does the trick for you, okay? Good luck to you now. Bye-bye.